My name is Dr. 𝐼𝐧𝐿 𝐼𝐺𝐿. I'm a UK-trained consultant general adult psychiatrist and a clinical director in integrated community care and recovery services at the Birmingham and Solihull Mental Health NHS Foundation Trust. By virtue of my role as a psychiatrist, I come across on a daily basis numerous patients presenting with suicidal ideations and suicidal attempts, and these referrals comes in droves from different sources. Suicide is not the desired outcome for every patient we see, and it's not an outcome any professionals working within mental health services wants to experience because of the far-reaching effect not only on the professionals, and also the effect on families and friends of those individuals and patients who have attempted suicide. Suicide is a global phenomenon, and it cuts across different socioeconomic classes and different, communities and society. It's a global problem, and particularly with mental health and increasing incidence of mental illnesses post-COVID, we have seen the epidemic of suicidal attempt and suicidal behavior in recent times. The statistics are quite staggering and worrying, and the causes of suicides in our society are many, not only mental health related, but in our practice we see a lot of patients presenting with suicide as a result of mental health problems or by virtue of one psychosocial crisis or the other. The current and prevailing socioeconomic situation across the globe, increasing inflation, reduced income, family breakdown, isolations, disasters, separation, and all these wars and rumors of wars going around places are contributing to the incidence of suicide in our society. So we have a job to do. The World Suicide Prevention Day helps us to bring into focus the problem of suicide in our society. Particularly Ferdinand Foundation is an organization that is set up to increase awareness of mental illness and mental disorder within our society, and they're doing a very important job in ensuring that we bring to the fore the discussion around suicide and suicide prevention. I'm not going to talk about causes of suicide. I've mentioned quite a few. It's not one size fits all or one particular cause. What causes one person to attempt suicide in one society or community may not be the same reason why other people attempt suicide. And as I said earlier, it cuts across different socio-economic class. The rich, the poor, the low income, the middle income, and the high income countries experience suicide on a daily basis. According to the World Health Organization, about 1 million of people attempt suicide in a day, and also within those ones, almost 20% of them will complete suicide. So it is a big challenge in our society, and it is one that we need to talk about continuously. Suicide is not the outcome we desire because it's irreversible. It's an irreversible situation, but it is preventable. So therefore, the mental health professionals, the government, and the community at large have a lot of work to do to ensure that the incidence of suicide and completion of suicide in our society is brought to the barest minimum. So at this time of the year where we are bringing to the focus this World Suicide Day, let us increase awareness about mental health. Let us talk to one another about suicide. Let's make sure that the stigma that surrounds people presenting, to mental health services or to professionals for help is brought to the barest minimum. As a consultant psychiatrist, in my clinical practice on a day-to-day basis, I see patients who have come with symptoms of suicide or presented with suicidal ideations in different forms. Some of them try to take overdose. People have tried to hang themselves. Many have thought about jumping off the high bridge. A lot of patients we see also think about putting themselves before the high-speed train. We have seen people who have tried suicide by trying to suffocate themselves, and other people have tried to drown themselves, and many people have actually committed suicide by directly, using the car that they drive to kill themselves as a weapon of suicide. So people who are suicidal can be very creative in their ideas. They are preoccupied with suicidal ruminations, and oftentimes they do not tell anyone about their problems until they commit suicide. So therefore, we need to identify the telltale signs, the early warning signs, the heralded symptoms to help us intervene and make sure we get the help they need for them at the right time. No one should experience mental illness and not have treatment or support that they require to get better. Stigma should not stand between mental health problem and recovery journey for our population. So we have work to do. So let's go out there. Let's talk about suicide. Let's bring the awareness to the fore. It is not stigmatizing to talk about it. It is important that we know what every individual is going through so that they can get help. You may not think you can get solution to your problem, but when you discuss this problem, oftentimes you will get help, you will get the solution you need. As psychiatrists, we will treat the mental illness and symptoms and signs underlying suicidal presentation, and we will bring support that's required. If it requires social prescribing, if it requires other crisis management intervention or other crisis, approach and evaluation, we will do everything we can to ensure that we do not have the outcome of suicide. The message from me is that let's talk more. Let's keep the conversation going. Suicide should not be the outcome for anyone suffering from mental illness. My name is Dr. 𝐼𝐴. I'm a consultant psychiatrist. I'm a mental health practitioner in the United Kingdom. Let's stop suicide and let's make sure people get the help they need at the right time. Thank you.